On 29th December morning, I got the blood in my urine.
And he underwent biopsy and a stent placement elsewhere before coming to me.
My name is Ashok Jain. I born and brought up in Chandni Chowk, and last 54 years I'm living in Japan. Then I went for testing and it has been diagnosis there is some pulp on the junction of my ureter and bladder. Then since I am also involved in the cancer equipments, so I contacted the people to whom know many institutions in Delhi and Bombay, and they advised me that I have to get removed. I went to meet a common friend of us, doctor, and he told me you can go to Apollo and just get consultation from Dr. Rajesh Taneja.
So Mr. Ashok Jain came to me with a diagnosis of something in the passage of the right kidney close to the urinary bladder. We call it a lower ureteric tumour.
When I came to meet Dr. Rajesh Taneja ji, his personality was excellent. He gave me so much confidence that of course my wife was not agree to get operated or surgery without having the final day or decided. I requested doctor that I want to get my surgery today or tomorrow because I don't want to hold it.
And the biopsy unfortunately was labeled as a high-grade transitional cell carcinoma, which translates into a little aggressive cancer of the ureter. So with this diagnosis, obviously it is not the patient who suffers, it is the whole family that suffers. And therefore they all came in, and when I looked at the scans, I realized that this was a treatable condition.
He agreed. I got myself admitted on 23rd. It was Tuesday. On 24th morning I have taken to the surgery.
So we did what we call a robotic-assisted nephroureterectomy from the whole kidney to the cuff of the bladder. We had a wide excision of the involved tumor, and we removed that part of the bladder in a single go using robotic surgery. So we do what is called a single dock nephroureterectomy, which not many people are doing. And through the same approach, we removed the lymph nodes around that structure. We call it ipsilateral pelvic lymph node dissection, complete with robotic technique.
Surgery was fantastic, done by him, and I went back to my room. Whatever the instruction, medicine he told, I took it. And 26, I feel that I'm ready to move.
And we are hopeful that nothing more would be required for this, but we will still look at the histopathology of the tumor and we will advise him the follow-up. As of now, cancer treatment is like a war. We need to win each battle. So the current battle has been won very well. The patient has withstood the procedure very well, and he has really fought hard, and I'm sure we will be victorious with this tumor.
I'm really grateful to him and the doctor who introduced me or recommended me to go to him. Thank you, Apollo Hospital. I am fully satisfied, and I can say the perception about this hotel was really great. Thank you very much indeed, the whole team of the Apollo, given their services and taken care of me. Thank you very much.